So, Bismillah ar-Rahman ar-Rahim. In continuation of our previous lectures about healthcare accessories, today we'll learn about orthopedic braces and surgical fittings. Where orthopedic braces and as I've told you about example of dental braces, these are helpful. Similarly, there are orthopedic braces when there is first is cervical collar. There is if there is a person suffering from spondylitis or some problems in the spine, they need some accessories. There is cervical collar. They are fixed their during the cervical area. So keep it that one. Cervical collars are used to provide support or limit the range of motion of neck. These may be soft or of foam for a mild support and stability. What happens that in certain cases there's a degenerative changes in patient in the old age, degenerative changes, or there is some fracture, some accident, so the patient cannot move. So what they use to put some collar accessories. You can see in this picture there is a cervical collar over there. They fix a collar over so fixed that neck. So wherever there is a compression over the spinal cord, what happened that in spondylitis there is a compression over the spinal cord. So it relieves that pain. When you put some cervical collar, it relieves that pain by fixing. So it fixed that neck over there, so there can be no more pain. So these are the cervical collars. Then they go for shoulder immobilizer. There is certain type, there is a fracture happened to a patient. Now they have to stick the shoulder in one place. So what they need shoulder immobilizer. So whenever you have to go to work, wherever, so it has to be fixed over there. It keeps shoulder and arm still. They are used for separation, dislocations, and injury to the shoulder. So you fix over because while you will work without placing every shoulder immobilizer, that bone, the fracture can be deteriorated. So that's why you have to fix that shoulder or arm, whatever it is. So it's a shoulder immobilizer used as a accessory. Then there is clavicle support. Sometimes the clavicle bone has been fractured over there. So then you need a clavicle support accessory. So you fix according to that called figure 8 step because of their appearance are used as aids for the reduction and stabilization of clavicle fracture. So this clavicle fracture is quite difficult. Whenever you have to fix that clavicle fracture. So you need a clavicle support also. Then tennis elbow. Sometimes you have a simple over there's a sprain over there while walking or some holding some, you're taking some weight, there is sprain. So what you do, tennis elbow applies pressure to inflamed forearm muscles to provide support and cushions to those with tennis elbow. So you fix that. You may have seen this tennis elbow also. It's made up of cotton, whatever it is. So it is a flexible. So it's hold that your elbow when you place that tennis elbow as a accessory. Then wrist braces is there. So sometimes you have a sprain, tension, whatever happened to your wrist. So put wrist braces. Braces are used to reduce motion and to protect and stabilize wrist from sprain and strain further, avoid further. So there are different type of wrist braces you can see. Sometimes you may have experienced while you are playing cricket, whatever. So you may have certain pain on your that one. So you need certain type of braces over there. So these are fixed over the hand over there. You can see these braces also. The arm sling is sometimes you need arm sling. Sometimes when there is a fracture over the bone, so they have put some temporary arm sling. So there is a fixed, this type of arm sling also available. The arm slings are used to provide comfort and support during recuperations from the fracture, sprains, and surgery. So they used to put these arm slings also. Then rib belts also. Sometimes there's a fracture of the rib. So these rib belts are used to stabilize rib fracture. Female rib belts are shaped to go under the belts because you can't put plaster over there. In certain fractures, you put plasters of Paris or you put plaster that fracture also. But here you can't put some plaster. So what you need? You need rib belts placed over the ribs area. Then abdominal support is there. Sometimes supports are used to provide abdominal supports and to hold surgical dressing. And if there is surgical procedure has to be done, there have a surgical operation. Then for holding of that belly or abdomen, they need abdominal support exercise. In certain cases, still some patients have a long belly also. They need certain type of these supports they fix over that belly, so it condense belly up to that one. Then knee braces also. Sometimes they have pain on joints, knee joints. Then knee braces are also used. Temporarily, this can be used, or in arthroarthritis, or in such cases, this has to be applied. Knee braces, knee cages are used for stabilization and support of knee. Then you go for knee immobilizers. And mostly, I've seen to one of my students, he was a polio victim. So he used to be these knee immobilizers, the whole leg over there. Knee immobilizers prevent any motion of the knee and are used for severe injuries or fractures. So knee immobilizers are also used. Then home diagnostic aids are nowadays. Oral thermometers are there. You have an experience of these thermometers just to check your body temperature. When you have fever, you have to check with oral thermometer. Another type is a rectal thermometer. If you can't take the patient that oral through, they can be applied a rectal thermometer. You may have seen in your pharmacology practicals that these rectal thermometers are placed under the rabbit's rectums to check their temperature. Then electronic thermometers are available. So certain these thermometers also use the accessories to check the body temperature. Electronic thermometer, simply they place over there and then they check the body temperature. Then liquid crystal thermometer. Nowadays, there is liquid you place over the that forehead, and then they have to check the thermometer, known as liquid crystal thermometer. Now, there is a disposable thermometer. Just because to avoid any infection, you need a disposable thermometer. Put over the check the temperature, then throw it out. That is disposable thermometer. Then baby soother thermometer, because it's very difficult to check oral temperature of the baby. Sometimes you have to check the temperature of babies from axilla. So to get the normal exact reading of temperature, you put for baby, so it's a baby soother temperature. You put a soother and then check body temperature of baby. It is a baby soother thermometer.